Hi, my name is Jennifer Higginbotham, and my community health nurse presentation is on a hospice nurse. So the definition of nursing, individualized care given to patients that enables them to participate as fully as possible in the activities of daily living. This is also true for hospice nursing as well. So the educational requirements are an associate's degree in nursing, an ADN nursing degree. A bachelor's of science in nursing degree is preferred, as well as certifications for hospice and palliative care. I've also posted the link if anyone is interested at the bottom. So hospice nurse. A hospice nurse provides care from the point in which the illness is diagnosed as terminal and provides care through the end of life. This is usually if the patient has a life expectancy of less than 6 months. The highest value is placed on dignity and respect for the patient. And this comes when the nurse is advocating for the patient and fulfilling the patient's wishes. So the primary activities are the same with any nursing. They're going to be the 6 steps of the nursing process: the assessment, the diagnosis, identifying any outcomes, planning, implementing, and then evaluating to make sure that the patient has the best outcome. Necessary skills and abilities. The ability to care for and comfort patients during the death and dying process sounds a little easy, but this is very trying and can be very discouraging and also very weary on the nurse that's taking care of the patient. The nurse is also going to support the family during these times, providing emotional support. And the nurse will also need a firm foundation in any home care skills, must have a knowledge of the community resources, and this basically means knowing what's available in the area should the patient decide or the family decide that the patient would like to go inpatient, or any kind of grief counseling, or if there's funeral homes present. And the nurse will also work to manage the multidisciplinary team. And so the physician has the choice, the attending physician that's referring the patient has the choice to maintain care of the patient and continue to be the ordering physician, or can sign over complete care to the hospice attending and the nurse practitioner, and they'll resume full responsibilities, and the nurse will receive orders and collaborate with this team when it comes to caring for the patient. So the role of the nurse increases as the patient's potential decreases. This basically means that as the patient becomes more and more ill, the nurse is needed and her responsibilities, or his responsibilities, will increase. So make daily assessments and decide the patient's need. This is to take on a proactive role rather than a reactive role. The responsibilities will also be for symptom and pain management, maintaining optimal nutrition intake, helping with bowel function, mobility versus immobility, and then caring for and helping with quality of life. And this is by forming a partnership with the patient and the family. So teaching and learning aspects for the community is that there's both inpatient and outpatient facilities. There's home hospice care that can come that's available 24 hours, and it's available to patients with a terminal diagnosis with a less than 6-month life expectancy. And you can choose from different facilities. You don't have to you just choose from what's presented. If you have had a better experience with one type of hospice, you can certainly choose that one as well. Some unique facts that I learned while studying about the hospice nurse is that hospice itself is a global concept. It's practiced in many countries, not just in the United States, and might have began back as far as the 11th century, where people were caring for the sick and the dying. The first hospice in the United States was in Branford, Connecticut, and also too the Medicare hospice is one of the only Medicare benefits that includes pharmaceuticals, medical equipment, 24-hour access, and support for the loved ones as well. So this is my nurse presentation for hospice nursing care, and it truly does take a unique individual to be able to help support these patients and be there for the families. And certainly my hat goes off to them, and I have much respect for hospice nursing. Thank you very much.